All right, welcome back. Now, today, May the 31st, is World No Tobacco Day. The third South African Demographic and Health Survey, SADHS, conducted in 2016 by the Human Sciences Research Council, Statistics South Africa, as well as the Medical Research Council and the Department of Health, indicates that tobacco consumption is decreasing. Tobacco use impacts negatively on personal health as well as national economic development. From our Cape Town studios, we joined this morning on Skype by Professor Priscilla Reddy. Prof, good morning to you and thank you so much for coming through.
Good morning, Palisa, and good morning to the listeners.
Now, Prof, just school us a little bit on the origins of this day and the objectives thereof.
World No Tobacco Day is a day that's been dedicated by the World Health Organization to the celebration of health and to raise awareness around the issues that are created by the use of tobacco.
Yeah, and we've seen many governments taking strong action against the use of tobacco. If we were to look here at home in South Africa, if we were to look a little bit on Tobacco Products Control Act, certain areas were banned for smoking and so on back in 2000. How are we doing?
Well, I think the whole comprehensive view that the South African government has taken around tobacco has really resulted in some good dividends. As we see, the rates have dropped, both in males and females, as well as the youth. And the youth are a very important group because tobacco-using behavior is a behavior that starts when you're young and continues into adulthood. So we've done well. But having done well, it doesn't mean that we should be complacent, because while the rates have dropped, they're still pretty high.
Mm-hmm. So I remember last year on this day, the Health Minister, Aaron Motsoaledi, made mention of the government's intention to actually ban the selling of cigarettes over the counter as well as your cigarettes dispensers and so on. Do you think this will also address or help in terms of addressing this challenge?
Yes, I do think it will help. South Africa was one of the leading countries as a signatory to the FCTC, and as a signatory to the FCTC, there are a whole lot of stipulations that have been put down that governments have to follow, and that's one of them.
Now, let's focus a little, Prof, on the research that was conducted. Talk to us about your sample for the SADHS research and the issues that you look into. Take us through the area as well as the numbers where the reduction was also seen.
Okay, if we look at the South African the survey that you're referring to now, sorry. The HSRC itself did not conduct that survey. That survey was conducted by Stats SA. So we've taken the report and we've looked at that data. We haven't had access to the raw data yet. But I think there's some very interesting points that are coming out. For example, the difference between high-income group smokers and low-income group smokers. If you look at high-income group smokers, there are more men than women smoking. If you look at low-income group, sorry, it's the other way around. High-income, more females and fewer males. But in low-income group, more males and fewer females. So you see, as women become empowered, financially, I mean, and there's more disposable income, what the data is suggesting is that women start smoking, and the rates of smoking among women in South Africa is relatively low. We need to work really hard to keep that rate low.
Yeah, and what are some of other interesting findings from this latest research about smoking generally here in South Africa?
I think it's always, the smoking issue has always been a provincial issue in a sense, with the Western Cape and the Northern Cape showing the highest rates of smoking. And this data has also demonstrated that the Northern Cape and the Western Cape lead the smoking rates. And if you lead the smoking rates, the issue around that is cardiovascular diseases as well as cancer.
And your work generally, how does it tie in with the work of your other counterparts, more so around the world, in fighting this use of tobacco?
Well, as I said, South Africa is really a lead country in terms of the FCTC, the Framework Convention Against Tobacco. So the world smoking rates are around 21%, and we are slightly higher than those rates, as shown, in several surveys, not just this survey. I think we need to do more, both in terms of interventions and in terms of research. In terms of research, we need to be very cognizant of the determinants of smoking behavior.
Yeah.
Because smoking behavior is not an individual behavior. It's influenced by a whole lot of determinants, i.e. factors outside of the actual smoking process.
Yeah, Prof, let's leave it at that for now, but thank you so much for sharing your insights with us this morning.
Thanks. It's a pleasure.
Thank you very much indeed. There you have it. That's Professor Priscilla Reddy talking to us about today being World No Tobacco Day. If you look at the statistics, that nearly 6 million people are killed by tobacco every year, and 600 die from second-hand smoke, inhaling smoke from people who smoke around them. Well,